A number of nations moved to stop air travel from southern Africa on Friday, and stocks plunged in Asia and Europe in reaction to news of a new, potentially more transmissible COVID-19 variant. Medical experts, including the World Health Organization, warned against any overreaction before all elements were clear, but nations who acted said that their concerns were justified. Belgium became the first European Union country to announce a case of the variant. It's unclear where the B.1.1.529 actually emerged, but it was first detected by scientists in South Africa and has also been seen in travelers to Belgium, Hong Kong, and Botswana. Comparing the pattern of disease in outbreaks to the genetic sequences and sorting whether there is an actual connection can take time. Some scientists have speculated that the new variant arose in an immune-compromised patient because of the large number of mutations.
So the coronavirus is a sphere, and from that there are these spike proteins which stick out. The spike protein is really important for the interaction between the virus and our cells. It acts like a key to unlock those cells. When we've had a vaccine or an infection, our body makes antibodies which bind to that spike protein, that key, and block them from working. Now, it looks like the coronavirus has gone and got itself a new version of the spike protein by accumulating quite a few different mutations. And that means it's got a new key. And the antibodies that we had before can't stick to that key. They can't stop it from working. But it appears that the key activity still works. But we don't really, at the moment, have a great idea of what effect that has on the transmissibility of the virus.
Laboratories around the world are already examining the new variant, and concern is growing that, like the Delta variant, it could be more infectious, and if unchecked, it could become the most dominant strain of the virus.
Well, they'll look at the genetic code of the virus, which is RNA, not DNA, and they will be able to tell from that what mutations there are and be able to predict, and this is just a prediction of what it will do, but you need to go on and verify that with lab studies and wider population-based studies.
The WHO cautioned the public to not jump into conclusions on the new variant, as their technical working group is set to meet on Friday to assess and name it. Coronavirus infections rose by 11% in Europe in the past week, the only region in the world where COVID-19 continues to rise. The WHO's Europe Director, Dr. Hans Kluge, warned that without urgent measures, the continent could see another 700,000 deaths by spring.